In Cape provincial government has said today it now believes the number of active cases of COVID-19 in that province is decreasing quite quickly, and that the rate of people being tested and found to be positive for the virus, the positivity rate, is also declining. The province says it will now focus on investing billions of rand in infrastructure projects. Joined now by the MEC for Roads, Public Works and Infrastructure in the Eastern Cape, Babalo, Madikizela. MEC, good afternoon to you. Thank you for your time. Firstly, if we can just check in with the virus in the Eastern Cape, your Premier, the Eastern Cape provincial government has been talking about this today. You seem to be quite optimistic you're getting over the worst of COVID-19, that the peak is over. MEC, are you with us?
Hello? Yes, I can hear you.
Hello, MEC. Sorry. You seem to be quite optimistic that the worst is over in terms of the peak in the Eastern Cape of COVID-19. What makes you think that is the case?
We hope it's over. We hope it's over, but as well, always in ways. But as far as our infrastructure, I think we are relatively ready with the works that we are doing, doing our hospitals. I think we are relatively ready for anything. As we speak now, all our hospitals have not really been occupied to full capacity. And with the works that we are doing and that we will be doing for the next month or two, I think we should be fine for any eventuality from where we're seated.
Okay, so I know there were some problems at some hospitals, some of them to do with buildings. I know that there were plans to refurbish some of those hospitals. Are those plans going to continue?
Yes, we have, but we've finished most of them, except the bigger projects that will be finishing some of them this coming month end, but will be done with all the infrastructure revamp by the end of October. So, like today, we had a tour with the journalists. I'm sure they saw what we're talking about. Most of the works are between 70 and 80% in completion. So we should be fine in terms of our infrastructure, even though we agreed that our relative infrastructure is dilapidating in most hospitals. You've got hospitals that are 8 years old. Some of them were built with mud blocks. So, but we still relatively have bad infrastructure. But with the little budget that we have, we are convinced we've done our best to save the people of the province.
Okay, I mean, there's surely a lot of work to do on the infrastructure in the longer term. I mean, people don't deserve to be in hospitals that were built 80 years ago.
Yeah. But that also we will be trying to maintain our property going forward, that they don't dilapidate, because as you are saying, our people don't.
Okay. There are also schools in the Eastern Cape that still don't have proper water and sanitation. I realize this gets into the basic education department. I realize there are national campaigns around this. But you are the MEC for Infrastructure and Public Works. Are you going to be working on those schools in the Eastern Cape that don't have proper water and sanitation so that children in the Eastern Cape don't have to use a pit latrine?
We are busy with that. You see, generally our infrastructure is old, dilapidating. Most of the schools were built by the communities using mud, but we are trying. The only issue that we have is the budget constraint. Now we are starting all our budgets, but that's things that we'll be looking at going forward. We've done some work, we've done some good work. There are quite a number of schools that have been built, but even on sanitation, there are many wards, many villages that have been given water, but obviously because of the nature of our province and the resources that are really limited, we are trying our best. But we hope in no time we will overcome. But we have got a clear plan. We know what needs to be done. All we need is just resources.
Okay. I mean, you talk about the nature of your province. I fully understand that, and the past from which we come, and the fact that you had both the Transkei and Ciskei there, and those areas still very much under-resourced. But you've used the phrase dilapidated several times around infrastructure. It is the work of your department to maintain that infrastructure. Surely it shouldn't be dilapidated. It can still be properly maintained. Look,
the truth of the matter is that we've just been given this infrastructure responsibility now. And we are also starting to position ourselves as a department, as the infrastructure center of the province. As such, we have appointed a team, a PMO, that will handhold the department in trying to transfer it to be the infrastructure center that we want. And that will capacitate the department and try to make sure we use less consultants, we use more of the internal capacity. So we've done analysis of what needs to be done, even on maintenance. Even the hospitals, a little that we're doing now, will also be having a maintenance plan and maintenance team that will be running. So hence we've decided to appoint a PMO that will assist the department to build the capacity that we need. That will talk to the new mandate of being an infrastructure center as the department. So we might have left things to run as they are currently, but we know where we went wrong, we know what needs to be done, and we know exactly what we'll do to turn things around.
Okay. Are you able at this stage, and I understand all the problems that you're dealing with, I understand the difficulties, but I mean, I still cannot believe, and I think frankly there are many, many people who cannot believe that so long into democracy we still have so many children who have to use a pit latrine, a dangerous pit latrine, never mind the unsanitary nature of it, just a dangerous pit latrine when they're at school. Are you able to say in the Eastern Cape maybe by the end of this year or the end of next year that this is going to be fixed? Can you give us a deadline?
No, I can't. As I'm saying, even democracy did not necessarily come with added resources, added budget to the areas that were previously disadvantaged. So there's a lot of backup that we need to deal with. So I can't really say now because with the new normal, even the infrastructure that we put now, a school, for instance, that was 20 million before the COVID, can't be 20 million now because there are new needs. We have to revise everything, and so we can't really say. And we don't really know with the shrinking fiscals and the technical recession. We are not really sure how much money we'll get, where we'll get it, to be able to refurbish the entire infrastructure that we have. So we can't really say. But one thing that we can commit, we know what to do, we know what needs to be done, and we've got a plan. All we need is resources. If we can have the surety over, no, you'll get this amount about this date, then we can be sure that we'll be finished with this at this particular date.